Okay, so the first thing is foot stability. So we stand up and everybody's barefoot, and I think that's the way to do it. Because what I try to get people to do, right, is to get your foot in an ideal posture, meaning it's not to the inside or out. And then once you're in that ideal posture, right, you want to try to load your weight onto it and just march this other leg up. And what I want to see is that people can stand on it for 10 seconds. And if they can't, then I mean it's just as simple as training this, right? And you can do things like bouncing the ball, you can do things like throwing the ball around your back, but you want that nice 10-second hold. And if somebody says, well, I want one more thing to do, what you do is you start brushing your teeth like this.
Or here's what I do after all of our hard days, we do these.
Yeah, exactly right. Anything adding a leg movement. It could be those, it could be out to the side.
Yeah,
that's great. And especially working with runners, right? I think this is a great one to do because you're learning to remain stable on this side and you're crawling up to this side. So
I think I don't know what I'm doing. We do this.
There you go. Accountability. So what you'll notice is as you do it longer, you'll feel the arch of that foot start to work a little bit more. And the other thing to do, right, so this is mobility, but this is a good trick that you'll notice that people are very dependent on their visual sense and they have poor proprioception. Because you have the eyes closed, right?
That's
so,
multiple messages.
So I'll close eyes and then, just have them hold. And that's a very quick screen, and that's kind of, it's real hard. And what you'll notice, especially people with glasses, you're so dependent on your eyesight onto right on the horizon that once you take that away, it's like, what happened there?
Look at the wall.
You just pick something out. And what your eyes are real sensitive at is you'll look and it's like, okay, my eyes are starting to lean, my eyes are starting to lean.
Yeah, because like all the senses, everything in your eye, you take that one sense away.
So when you take that away, and you can even do these kind of little running drills like this, I mean, it's a lot.
It's multiple. So I would use it. I worked with a couple athletes with some head injuries, traumatic drum, pacing. One of the first drills we worked on was not running, was doing this. And what this did is it sent multiple messages, and it worked for brain harder than it worked than just running.
Yeah, and if you find somebody that's really challenged, right, and has problems with that, then what I'd do is keep a little foam like this, right? So we've worked with these.
Yeah.
But then, I mean, even just as simple as there, and then eyes closed, and then so the thing about eyes closed is great, right? But then you also want to train runners because when you're running, you're scanning your environment, dog, car, bike, right? So you get here, and then you start to turn, which is a lot harder, obviously, right? Because then you're learning to kind of look there, and then you go up and down, up, down.